is the 13th National Health Research Forum. To Lesotho, the scientific inquiries should ensure that the health system remains responsive, inclusive and sustainable to the needs of an ordinary Lesotho.
The Ministry of Health remains firmly committed to this path, promoting innovation, building capacity, and supporting the use of data to drive improvement in health service delivery.
To some of the development partners committed to assisting the kingdom, they believe that the research should never be just an isolated academic pursuit. It must rather be designed for practical application by policymakers, business and all stakeholders.
Because Switzerland knows Lesotho, actually. My country, Switzerland, firmly believes that health cannot be a question of income. It is a fundamental right, and fundamental rights belong to everyone.
And Vietnam, one of the recent most critical TB trials held in Lesotho, it has been concluded that the future research is required to optimize regimen composition duration, while also requiring internal control to accurately interpret well-performing experimental regimens.
Now, in the NTBQ trial, the careful monitoring, prompt management, rigorous reporting of adverse events, we observe that the permanent discontinuation of drugs was rare, mortality was low, I show it on the graph, it was 2.4 in each arm. And the frequency of QT prolongation also was rare. Now, the NTBQ reinforced the importance of quinone resistance in the management of our patients with DRTB and pre-ex-DRTB.
There is a disparity between Mohoro and Botaro.
And as conversations get heated, even the minister is not taking things for granted.
So I'm still expecting the answer from you. Why there is disparity?
And when we sent one of the advisory committee members to go and dig deeper, what we found, and he acknowledged that before going to the clinic, he just threw away the tablet in the toilet. When he comes, he knows exactly how many pills will remain, and he knows exactly that the adherence will be 100%. And when they do, they calculate the adherence is 100%. In the document, it's 100%. But in reality, that is not taking the medication. So you have these two cases in Mokotlo, just to show you how it's difficult when you are in the office, looking at the data and say why this patient is not suppressing and with a good adherence.
While there has been commendable progress in efforts to end TB and HIV/AIDS, the recent U.S. executive orders and trade tariffs are yet to punch a hole in the progress made. According to Lesotho, this is a wake-up call to be more creative in mobilizing limited resources.
Who will have the way to give the services to our people regardless of the executive orders?
How do you allay fears of somebody who's saying, am I still going to receive this medication? In the meantime, while
you know, the good thing about Lesotho is that 83% of our ARV, they are procured by the government of Lesotho, while 17% we are assisted by the Global Fund. And it says even 100% of the drugs we can be able to procure as the government of Lesotho. So there is no way that our people can panic that they will not have access to the drugs. They will still have access to the drugs. What was the challenge on our side? It was the human resource. We have been heavily supported by the American government in relation to the staff, but we have found the ways to respond to that challenge. That as government will have to use our own structures in government and absorb the human resource and pay them so that they continue giving the services to our people.
Due to time constraints, The abstracts that could not be presented will be made available to the National Health Research Symposium. I'm Rapelang Khatebe for SABC News, Masego, Lesotho.